After a surge in COVID cases across the country, India is witnessing a steady decline in active COVID cases. In the past 24 hours, 743 new COVID cases have been reported, and this, of course, includes 129 cases of JNN which already exist in the country. With this, the number of active cases in India has now reached 3,997, which is still a decrease from the count of 4,091 cases that were reported yesterday. Despite the steady decline, Kerala, Goa and Gujarat have been reporting an increase in daily COVID cases. Kerala, in fact, has reported 40 new cases of JN1 variant, while Gujarat has reported 30 new cases. The national capital has also reported one case of the new JN1 subvariant. And as far as the deaths are concerned, 7 deaths have been lodged in the past 24 hours across India. 3 of these were from Kerala, 2 from Karnataka and 1 each from Tamil Nadu and Chhattisgarh. Ishika joins us live on the broadcast to get us more information there. If Ishika, this is of course a concern there, COVID cases increasing. Yes, there has been a slight decrease. The number of active cases has slightly come down, but at the end of the day, the Union Health Ministry is still on an alert. The states are also making sure that all the preparations are in place. Give us a sense of what the total COVID tally is and also the next steps that have been planned by the government, the state government and also the union government.
Well, Ashish, as you rightly pointed out, that in fact, there has been a declining trend. If we talk about the number of active cases in the country, right now it stands around 3,900 mark. Now, if we talk about, the JN.1 variant, well, 129 cases have been, reported of the JN.1 variant, with the maximum coming from Goa itself. In fact, let me tell you that 30 cases, from Gujarat has been reported, 8 from Karnataka has also been reported, 20 from Goa, 40 from Kerala. And in fact, if we talk about the national capital here, then 1 case of JN.1 variant has been reported till now. And as you rightly said, if we talk about the union government or even if we talk about the state governments, they are on a high alert here. Meetings are constantly being held. We did see how, in fact, the union minister had held a meeting with all the state health ministers as to how much, their states are prepared for fighting this new variant of COVID-19. Even if we talk about here in the national capital, well, Saurabh Bhardwaj, the health minister, he has been taking a lot of meetings with the hospitals and also, in fact, has directed all the hospitals here to make sure that any patient that comes even with flu-like symptom is tested for COVID-19. He has also ordered, genome sequencing of all the positive RT-PCR samples. Now, experts at this point of time say that certainly cases are not high here in Delhi if we compare it to the other states. But if the cases continue to rise, then, people should be responsible enough, to take the preventive measures and as we used to take during the lockdown, to prevent the further increase. Over to you.
Right, Ishika, appreciate you joining us on the broadcast there. These are, of course, the measures that are being taken by the Union Health Ministry and also the state governments. Of course, there is a declining trend as far as the active cases are concerned, but the governments are still on a standby and on alert. Shifting our focus